In this module, clinicians in training will learn about the barriers individuals of Hispanic or Latin American heritage may encounter when seeking medical services, as well as strategies to decrease potential biases to improve their cultural competence when working with this marginalized group. In this module, we will discuss the difference between Hispanic, Latino, Latina, and Latinx, how to learn more about individuals' culture through culturally responsive care, the effect of stereotype threat on the therapeutic relationship, how Hispanic and Latinos seek help for health needs based on current literature, the differences in communication styles across cultures, and finally, strategies to reduce bias during assessments and diagnosis. Individuals of Latin American or Spanish origins accounted for more than half of the growth in the U.S. population. Hispanics account for 18.4% of the U.S. population and 30.2% of the population of Galveston. There's a significant risk of underrepresentation as unauthorized populations are frequently not captured by the census. Both Hispanic and Latino are terms meant to describe people living in the U.S. of Latin American or Spanish origin. Hispanic and Latino are not universally accepted by the community it describes, with most preferring to be described by country of origin or American instead. Because these terms encompasses a large number of countries with a wide range of cultures, we should use these general terms with caution and refrain from generalizing this diverse population. Latinx is an emerging terminology used in academic, news, entertainment, and corporations as a pan-ethnic label to describe individuals who have Latin American or Spanish roots. While some view Latinx as a gender and LGBTQ inclusive term to reflect the broader movement of gender identity, the term isn't widely accepted, as some perceive it as an encroachment of the language. The term is not frequently used by the individuals whom it is meant to describe, as 76% of individuals who identify as Hispanic have not heard of the term Latinx. A survey conducted by Pew Research Center found that a majority of adults prefer other terms over Latinx. Among individuals who have heard of Latinx, 2/3 said it should not be used to describe the Hispanic or Latino population. Among all Hispanic or Latino adults, only 4% prefer Latinx, 61% preferred Hispanic, and 29% prefer Latino. Despite the well-intended meaning of a gender-inclusive term, Latinx is not widely used. Individuals identifying as Hispanic, Latino, Latina, and Latinx are not the same. It is of utmost importance to recognize that they have different ancestries, different countries of origins, and legal status. As the terms Hispanic, Latino, Latina, and Latinx may hold a significant cultural meaning to them, it is important to ask how they would like to be identified and respect the term they prefer. Ignoring the historical and cultural differences can result in poor patient-provider relationships and marginalization. We can learn more about a patient's cultural identity by actively and intentionally engaging with individuals of diverse cultures. Generate cultural knowledge by asking questions to colleagues and patients, such as how things may be done differently, their perceptions of health and sickness, and reading literature. It is important to remember that there may be differences within group as culture goes beyond race and ethnicity. Building cultural awareness involves self-reflection of biases, preconceptions, and assumptions. Recognize how individuals of diverse cultures may experience healthcare differently. Upon building awareness and knowledge of cultural differences, we can apply that information through asking intentional questions, observation of verbal and nonverbal communication, and using culturally appropriate assessments and interventions. Other ways to become more knowledgeable of unique cultural identities is by engaging with and building relationships with individuals of different cultures. It's also important to reflect on our own understanding of others and our own culture throughout this lifelong process. Cultural competence is important in building a trusting and collaborative relationship between patient and healthcare provider. Neglecting an individual's background, culture, and other qualities that make them unique can be detrimental to the therapeutic relationship and health outcome. Interaction between patient and healthcare provider can produce stereotype threat, defined as an individual's risk of confirming a negative stereotype associated with their racial, gender, ethnic, social, or sexual identity. Members of disadvantaged groups are aware of common negative stereotypes. Healthcare providers may unintentionally confirm negative stereotypes, and the patient will sense this bias. As a result, the therapeutic relationship between the healthcare provider and the client may be strained. The strained relationship between patient and healthcare provider may result in many behaviors that can complicate treatment. Patients are more likely to miss appointments or delay seeking care because they feel mistrust or discriminated against. Individuals may feel more fearful of disclosing important information because it may confirm stereotypes. They may also become skeptical of the importance of treatment and have difficulty remembering information. Training in cultural competence and engaging in culturally responsive care can decrease the risk of negative encounters. This, in turn, will result in more meaningful and productive relationships with Latino and Hispanic patients and encourage individuals to seek care in a more timely manner. While Latinos and Hispanics are a culturally diverse population, there are some patterns in help-seeking behaviors. Fatalism is a belief that health outcomes are determined by God. While some literature suggests that fatalism may discourage individuals from seeking care, research has also found that it may also encourage health-seeking behavior. There may also be a knowledge gap that causes individuals to delay a trip to the physician as they may be unaware of the severity of their condition. Diagnostic and treatment approach may also impact health-seeking behavior. Not only can language and culture make getting help difficult, lack of emphasis on holistic care can discourage them as well. Finally, as some Hispanic and Latin cultures may value collectivism, seeking healthcare and receiving a diagnosis may be associated with burdening the collective with a personal problem. Therapeutic relationship with individuals of Hispanic or Latin culture can be strengthened by making small adjustments to communication styles. Include family, especially male head of household, in the decision-making process. Involve faith and spirituality to motivate individuals toward a healthier life. Show respect by using formal terms to address individuals, asking how they would like to be addressed, and taking into consideration their background while interacting. Build a personal relationship by asking questions about family, friends, and even sharing your own background to help connect. Increase trust by working with them toward mutual goals and following through on promises. Finally, encourage individuals to take action by explaining the importance of screening and creating healthy goals to enjoy time with family in the future. Everyone has some unconscious bias that may affect diagnosis and treatment decisions. However, we can incorporate strategies into our everyday interactions to reduce bias. These strategies include asking open-ended questions to encourage participation, thinking about the patient's context and environment, listening to the patient's concerns as opposed to making assumptions of what may be important to them, consulting with colleagues and evidence instead of relying strictly on personal experience, and recognizing that we have our own prejudices and reflecting on how our own experience influences interactions. The following slides contain resources and literature for additional information about culturally competent care for individuals of Hispanic and Latin American heritage. We hope you find this presentation informative as you work towards becoming a culturally competent healthcare provider. Thank you for watching.